Our next guest is from Australia. She is Karine Shellshear. She comes from a background of social research, planning, policy and community development, an advocate of social justice. She has a Master's of Philosophy in Housing. She has been a teacher in higher education and was president of Australasian Association of Yoga Therapy. She is trained in the tradition of Krishnacharya and remains a student of Dr. N. Chandrasekhan and Saraswati Vasudevan. She presented a paper on the use of chakras in yoga therapy at the International Yoga Therapy Conference in Japan in 2018. She's teaching synchronized breath-focused yoga, incorporating guidance for a calm mind, strengthening and revitalizing the body and restoring the whole system.
Thank you.
Most welcome, Karine.
Thank you so much, and thank you.
Speak on the role of breathwork and yoga therapy for stress management.
Yes, I'm going to call on the slides, and the first issue I'd like to address is that I'll try and move through them fairly quickly. Next slide, please. Next slide, please. Yes. Yoga is, as many people know, it is to unite with the divine in everything as a state of peace, joy, and calm within. Next slide, please. In comparison, yoga therapy is to apply the tools of yoga, especially pranayama, to heal the mind from physical and mental stress and to realign each layer of gross to subtle self with a state of peace free from suffering. Next slide, please. Next slide, please. Yoga therapy uses breath work or pranayama and other tools to work with the vital forces, the vayus, to eliminate from the mind misconceptions, distortions, and disturbances, bringing the individual back to a state of wholeness and harmony with their own true nature, and using respiration to ignite the spirit or higher self. And there I'd just like to make the distinction between breath work, which can be mechanical, just like yoga can be mechanical, and pranayama. Pranayama is when you apply the mind to the breath, and when you're calling on that force of energy of prana within the breath and your awareness to maneuver that prana through the body to create a healing state. The important thing in yoga therapy is that the practice that an individual is given is practiced every day. Abhyasa practice, and with detachment, and with reflection, and bringing about ongoing self-awareness. Next slide, please. When we practice pranayama, the veil or cloud of avidya or doubt is taken away, and the mind becomes clear and ready for deep meditation. Next slide. Automatically, the mind follows the direction of the breath. So as the breath flows, the mind flows. When the breath is agitated, so is the mind. And it also follows that when the breath is calm, the mind is able to calm down. Next slide, please. Prana, the meaning of prana, when we talk about a pranayama practice, we're talking about extending prana, being the life force, that which is infinitely everywhere and vital to our existence. It's the flow of energy that fills us. It keeps us alive. It's our vitality. Ayama is to stretch. In so doing, in stretching the breath, we trigger the parasympathetic nervous system, calming the system. We reduce cortisol. We reduce high blood pressure. It changes the breath chemistry neurologically And you can see a lot of the work of Sweta Adatya on neuroscience that backs that. And things like alternate nostril practice help balance both sympathetic and parasympathetic. We might also use chant to strengthen and lengthen the outward breath. Next slide, please. There are five forms of prana. The 5 winds, the udana from the upper level, throat, speech, prana at the chest, samana at the central body related to digestion, both physical, mental, and emotional, apana at the lower abdomen related to elimination, and vyana vayu corresponding to the whole distribution of energy. So as yoga therapists, we aim to maneuver those 5 winds, those 5 forms of prana to produce healing where it's needed. Next slide, please. The 5 prana vayus carry vital energy forces through fine, subtle channels, the nadis. There are 72,000 nadis throughout the system, and pranayama helps to unblock the debris from the channels and brings the system into symmetry and harmony. Next slide, please. The quality of prana is aligned with our state of mind. When we are unwell, the quality of prana in the body is reduced, restricted. We can feel demotivated or depressed. Depleted prana may result in physical ailments or mental suffering, dukkha. When we're balanced and peaceful in a state of sukha, there is more prana within the body rather than leaking out. The purpose of practicing pranayama is to remove any obstacles and restrictions. Next slide, please. Mind influences breath, breath influences mind. Our actions can cause disturbance to the mind, which in turn expels the prana out of the body and makes us unwell. It creates dukkha. In yoga therapy, we aim to move from dukkha, suffering, to sukha, contentment, equanimity. We can reverse the process of suffering by addressing the breathing patterns and improving the functionality of all the vayus. Next slide, please. Why is prana so important? Because our quality of life or well-being actively depends on the quality of our mind and the well-functioning of the five vayus to carry that vitality in the form of prana. From a yoga therapy perspective, we are nothing but prana. It flows through the 72,000 nadis, of which 3 are particularly important. The Ida on the left, the Pingala on the right, and the Sushumna through the center. So we're balancing and clearing, and we're also able to observe imbalance within the system when it occurs. These nadis need to be cleansed in order to function effectively as the energy moves up through the chakras, cleansing impediments, our emotional DNA, which is often in the form of distorted patterns, beliefs and conditionings, ways of seeing, misconceptions, our samskaras, our vasana, our sadumis. The clearing debris is essential for effective functioning. We can then see clearly and discern the best use of our vital life force to maximize not just our well-being, but to create positive actions for others as well and make the best use of our lives. Next slide, please. Pranayama methods begin by paying special attention to the breath. A long pratyahara is a long exhalation with the focus on elimination. Vidarana indicates a comfortable suspension at the end of the exhalation. Rechaka pranayama technique brings the mind into a long, slow, uninterrupted, smooth, subtle lengthening of the exhale. Next slide, please. Patanjali's Yoga Sutra 148 advises that when agitation is settled, the mind becomes clear, able to see, discern at things as they are, in their absolute truth, like a flawless jewel. Next slide, please. It's important that we choose the right practice, that the pranayama is practice with conscious breathing that aims to relieve the individual of suffering, to move us from gross to subtle layers, the koshas, through to a state of calm and peace. The pranayama practice needs to respond to the needs and conditions of the individual. You can have an individual, for example, that's stressed and in high anxiety. You can have stress occurring by way of depression or pain in the physical body. So we need to be able to identify through the individual where and how it's occurring, identifying where the individual perceives the suffering, and identifying the cause, hetu, of the suffering, and how to avoid heya, this in future suffering. Next slide, please. Mastery of the breath is realized by regulating uncontrolled breathing patterns, shallow breath, irregular breathing, svasha prasvasha. And I particularly chose this topic because I came from a very long period of decades of being an asthmatic, and it was yoga that changed my life. So I'd like to convey that wonderful insight to other people and explain that we have 4 parts of the breath. I understand that there's not much time left, but the 4 parts are the pause after inhale, pause after exhale, and the timing, the number of breaths, the subtlety of the breath. And we may also assess other things such as the pulse and the heart. Next slide, please. We can use other techniques such as mental attitude, Vedic chanting, or meditation. All of these impact on the direction of the breath. Chanting, of course, can be used to extend the breath. Next slide, please. Pranayama is the journey of the breath to the spirit, as our previous speakers have mentioned. It's the journey to a state of wholeness. Initially, we might begin by disciplining the physical body, the annamaya, with asana. Then we use pranayama at the pranamaya layer, which is the bridge to the mental layer, the manomaya. And we move to the heart's intelligence, the vijnanamaya, through to that state of bliss, calm, and peace at the anandamaya, taking us to the very essence of self in peace with the totality, surrendered to Ishvara Pranidhana. Thank you.
I'll request Patricia ji to thank Karine ji.
Thank you, Karine. Wonderful presentation, and I loved your exploration of prana and pranayama, its purpose and its application, and also its power to heal. So thank you very much. That was lovely.
Thank you. And now we move on to a very exciting panel. So without further ado, let us introduce.
On behalf of United Consciousness, I thank Ms. Karine Shellshear for coming onto the platform of United Consciousness. Thank you so much.